Hello, everybody. This is Dr. K here with you right now with another interesting series on stress hacks, healthy ways to manage your life. Today, in today's topic, we shall cover stress-induced headaches. You know, they tend to appear on both sides of the head. It's not just not one side. Migraine headaches are always one-sided headaches. Half head headaches. Your stress headaches, the best identifier is they occur on both sides of the head. It feels like a pressure pain without the usual migraine accompaniments. What were your accompany, or what accompanies a headache when you have a migraine is normally nausea, sensitivity to light and sound. You get very irritated, photophobia, we could say, and it get worsened by head movement. These are the signs of migraine. Whenever you move your head, you just don't, you feel like someone is hitting you, has hit you with a rock. If you have a migraine and someone talks to you on a light volume, you get very irritated. If you feel like sitting in a dark room, and if there's suddenly a light coming up in that room, you are very sensitive to it. Your photoreceptors have to. So photophobia is one of the descriptions that we have. Now, how do you understand stress headache? The stress headache is actually like a band headache. It'll be like a band. It'll cover this portion, the scalp, your forehead. It'll be like a band from front to back. It'll be on your temples. It'll be on your neck, 2 points of your neck. These 2 points on both sides of your neck. So this is how you know that it's a tension-related headache. Normally, tension headaches, they start with your neck. They start with the neck pain. It is mainly tightening of the neck. You'll start feeling gradually from your neck. It will start spreading to your jaws. You'll feel a tightness in your jaws, locking of the jaws, and then it'll radiate down your shoulders. It will cause tightness, stiffness to your shoulders, tenderness of the neck. You'll keep moving your neck left and right, trying to think that it might relieve the pain, but it does not. So these, and scalp, your scalp, it hurts. So these are the tightnesses that you feel in stress-related headaches, and it can even radiate down your either you might find tingling, and all other kind of pricking pains, neuropathic kind of pains. But those are not neuropathic pains; they are actually stress-related pains. So it's very confusing to actually identify whether it is neuropathy or it's actually stress-related pain. But then we will deal with it gradually in our upcoming content as to how to identify and differentiate neuropathy from your regular headaches. Now, tension headaches are the most common type of headache, and are described as pain or discomfort in the head, your scalp, your neck, and often it is associated, as I said, with muscle tightness and tenderness of the muscles. You know, so they affect almost 70% of the population of the world. It's very frequent thing, and they range between half an hour to maybe even days, or maybe even weeks. So, I mean, it all depends on the kind of stress or the stress-induced environment that you are actually exposed to. So, and in order to be properly diagnosed with, this kind of headache, you need to have a history. You need to understand most of what are the history points. What are the You have to be more observant about how frequently you are getting these headaches. Now, as I said, tension headaches majorly is triggered by stress. Stress is one of the prime reasons of tension headaches. The exact mechanisms are unclear, but it's theorized that when people are experiencing stress, physiological changes occur in the body. The way I said it, muscle tightness. It's a way of your body saying it's an SOS. That it's reacting to stress. Like, come on, get up, cut cut yourself off that environment, stop talking to such kind of a person who is affecting you that way, and increase cortisol levels, and our fight or flight response gets revved up, triggering a migraine, or it's a migraine tension type of headache. Other triggers also, probably there are other triggers. They include alcohol, caffeine, excess caffeine, and your cold, flu, and sometimes dental problems, eye strains, And smoking, excessive smoking, and even even tiredness, fatigue, overexertion. These are all reasons of other triggers of tension headache. Now, uh, depending on the severity and the length, how do you tackle these headaches now? Depending on the severity and length of your headache, mm, probably it might go away on its own. If you just take a break and try to distract yourself from a present activity, or get yourself out of a present stressful environment, whichever is causing you stress, lying down, meditating, doing some light yoga, they are all great options. You can try those options out. Yoga is also very helpful. Pranayama is very helpful. And definitely, I will be telling you some acupressure points also in this video, which can help you relieve your day-to-day tension headache. Now, if the pain is really bothersome, it can be treated with over the counter if it's in an SOS, and you're finding that you're in a situation where you are not in a position to do anything, and it's stressing you out. And I think that time, yes, definitely, but most of it, by the time it induces, you get a hint that it starts from your neck, stiffness in your neck, and that's how it starts. Tension headache starts from your neck always. It doesn't start from your head, and then goes all over. So when you have over-the-counter medicines which are normally prescribed, are ibuprofen, and uh, I think that's how it is, or naproxen. I mean, but you have to be very, very careful of how many times you have to pop in that pill, because I don't think that is very much advisable. Keep that pill away from your lives. You know? I mean, as much as possible, unless and until you get to the situation that you might be that it'll just burst out. Then probably yes, just to relax yourself down. Even then, there are many other techniques which if it's reaching to a level that it is pretty frequent and it probably requires medical attention, definitely you can come to me. I mean, and and we can work out a solution for that. There is a separate solution with my special formulations, special concoctions, special oils that I might tell you to apply, and voila, you're out of it. So but if you find that you are taking medications more than once a week or a regular basis, that's a sign that you are getting increased headache frequency, and you should speak to probably your GP, the general physician, your doctor, your family doctor, about what might be causing that headache. You definitely need to discuss it out with a medical professional, rather than trying to tackle it yourself. So if and also one more thing, if headache is just not a normal thing for you, probably if you're 50, and if it's not normal that you get headaches, and if this is what is happening and you're witnessing frequent episodes of them, then I think you should speak to your neurologist, or a specialist, a neuro specialist, whatever. I mean, since it could signal something more serious within, and there's something more critical going on which needs to be diagnosed on time. There can be an underlying concussion or whatsoever that we will keep discussing in our upcoming content, which I will be continuously uploading. Seeing the enthusiasm that I get from your side, and please hit the subscribe button, share this video to as many people as you can, because headache is like a monster which we have to deal with every day, almost every day in our lives, keeping in mind the stressful environments we live in, we deal in, we work in. So yes. And headaches that consistently get worse or more frequent over time, accompanied by many neurological conditions such as double vision, numbness, tingling, paralysis, loss of vision, or even accompanied by a fever, needs attention. I think that is the time. I think it's like a precursor that's trying to tell you that, hey, you need to speak to your doctor. You need to speak to someone who might help you with this situation, rather than trying to dealing it yourself and trying to make it worse, which is normally what people do. you know. Despite a stress headache or two being normal, you know, uh, do not let them become a regular part of your life, for which something you have to adjust to. Please do not adjust to headache. It just does not go out, go off on itself. If it has to go off on itself, it's got to be momentary. If it goes beyond a moment, it definitely it's good to stay. So it's a very difficult time for many people, you know, when who go through it day in and day out in their lives. So be kind to yourself and relax even then you are under stress. I have been trying to tell you how to deal with stress, how to divert, distract, how to do the counting. There are so many patterns that we will keep discussing in our stress related videos, but now this series would cover all kind of headaches, in fact even precursors, triggers, treatments, over the counter treatments, naturopathy treatments, acupressure, all these even, so we will be discussing in our forthcoming videos. As I said, subscribe to my channel, hit that share button, make it, go out to maximum number of people who would require this much needed help. Press the like button, which will encourage me to come to you more and more with better hacks and techniques day in, day out. So, okay. If stress is interfering with your sleep and your mood, then I think uh, you need help to learn how to deal with it. So, that's all about stress, and hope you find these hacks helpful. Be tuned, stay tuned for more hacks. Subscribe to my channel, hit the share button, let the message go out to as many people as you can, people who you love, people who you're connected with, people in your workforce and all those, and hit the like button if you really like this video. See you again. This is Dr. K with another video on stress related hacks. Dr. K's got your back. Thank you.